Hi friends, welcome to the channel The Nurse. Here we are discussing about today's Kerala PSC nursing tutor exams professional answer key. So if you are not subscribed to our channel, please subscribe. So there was a nursing tutor exam today. So we will discuss the professional answer key they have given in official website. We will go to the topic questions. First question. Arterial blood gas analysis of pH 7.3, partial pressure of oxygen, that is 56 millimeter of Hg, and PaCO2 74 mmHg, and HCO3 26 millimeter of per liter indicates. So here you need to see first that pH. pH is less than 7.35, then it indicates acidosis. Then we need to see which acidosis. In this, for acidosis analysis, we want PaCO2 or HCO3. Here PaCO2 itself, it is 74 mmHg. That means it is respiratory acidosis, because normal PaCO2, that is 35 to 45, here it is increased to 74. So that means it is related to respiratory. So our answer is respiratory acidosis. So I am not going to detail in each and every questions, just for example I told. Then next question, right lumbar region is occupied by. Correct answer, in that they are given different similar examples. In that, option A is correct answer, because right lumbar region is occupied by liver, gallbladder, right colon, and in second option only right kidney is coming, because right kidney is usually seen in right hypochondriac region. So the second option will be wrong. In right lumbar region also small intestine will come, but right kidney will not come. That is why first option is correct. Then third question, spinal cord injury at the level of thoracic vertebrae 12, actually it was 12, and L1, L2 results in the following motor loss. Here correct answer is paraplegia. The spinal cord extends up to lumbar vertebrae, second lumbar vertebrae. So till that spinal cord is there. If any injury till there means there will be possibility of paraplegia, or if it is in cervical vertebrae, there will be quadriplegia. In cervical vertebrae, 1 and 2 means that will usually leads to quadriplegia, but it is in lower region, that is thoracic vertebrae 12th, L1, lumbar vertebrae 1, lumbar vertebrae 2 region. So that will leads to paraplegia. If it is only affecting the lower lumbar vertebrae, means there will be chance of mixed loss of bowel and bladder sexual functions. Also, if T1, L1, L2, there will be a mixed bowel, bladder and sexual dysfunction, and along that paraplegia is the main symptoms. Then fourth question, the venous return from stomach and intestine drains into. Here correct answer is portal vein. So venous return from stomach and intestine drains into portal vein, then it will go to inferior vena cava, then right atrium. Then fifth question, arterial supply of femoral head is by. Arterial supply of femoral head, that is by profunda femoris. Arterial supply of femoral head is given by profunda femoris artery. Then sixth question, appendix of epididymis is derived from. Appendix of epididymis is derived from. Correct answer is Wolffian duct. Appendix of epididymis is derived from Wolffian duct. Seventh question, the position which facilitate diaphragm excursion and enhanced lung expansion. The position which facilitate diaphragm excursion and enhanced lung expansion, that is, everyone knows it is a Fowler's position. Fowler's position will give maximum lung expansion. Then eighth question, The steps of hand washing when arranged in order includes. Here, correct step is, first one is wash palm of the hands, then back of the hands, then it will come to knuckles and fingers, then last thumbs. So for correct option is option A. First it will come palms, then back of the palm, then knuckles, then finally thumb. Eighth question. The recommended rate of flow of oxygen through a nasal cannula. A recommended rate of flow of oxygen through a nasal cannula, that is 1 to 4 liter. Through nasal cannula we can administer up to 1 to 4 liter. Then 10th question. According to principle of body mechanics, while lifting or carrying heavy objects, one must. Everyone knows body mechanics. So correct answer is option D. Have a wide base support. So our legs should be wide apart and we should in a stable position. That is a correct body mechanics while lifting a heavy object or a heavy patient. Then 11th question. The highest level of needs according to Maslow's of hierarchy of basic human needs. Correct answer, self-actualization. Critical pathways include identification of variants that always define. Correct answer, option B, that is patient-focused outcomes. So there will be a, if you understand the critical pathways means you can answer here. That is for CPR and all, there is a stepwise step for each procedures that is mentioned here. That is known as critical pathways of identification of various process. So here correct answer is patient-focused outcome. 14th question. While opening a wrapped sterile item, the nurse must first. So usually we need to open the outer covering in a away area, away direction. So here correct option is option A. Open outermost flap away from the body, keeping arm outstretched and away from sterile field. So correct answer is option A. Then 15th question. The temperature of water in the hot water bag, which is considered safer for normal adult and child over 2 years. So correct answer is option B, 46 degrees Celsius to 52 degrees Celsius. That is around 105 degree Fahrenheit to 115 degree Fahrenheit. That is a normal, the safer temperature for hot water bag application for normal adult and child. A child above 2 years. Then 16th question. What is the primary pathophysiologic process of spinal shock? What is the primary pathophysiology process of spinal shock? Correct answer, temporary loss of reflex function below the level of injury. So usually that will leads to vasodilation and all, then it will goes to shock. So if it is the corrected, then that loss will came back. Then 17th question. Polydipsia and polyuria related to diabetes mellitus are primarily caused by. Polydipsia and polyuria of diabetes mellitus is primarily caused by. Correct answer, fluid shift resulting from osmotic effects of hyperglycemia. So during the hyperglycemia state, that fluid shift will kidney will get more fluids to remove the excess of sugar. So that is what the pathophysiology of polydipsia and polyuria in diabetes mellitus. 18th question. A client has manifestation of autoimmune dysreflexia. Which of these assessment would indicate possible cause for this condition? So usually urinary retention or urinary obstruction may cause the autonomic dysreflexia arousal. So first one option is kinged catheter, that will cause obstruction of urine. So that will leads to autonomic dysreflexia. 19th question. The most effective intervention in decreasing absorption of an ingested poison is? So after taking or poison through mouth, so what is the effective intervention? So everyone knows activated charcoal is a universal antidote against most of the all kind of poison. So we can give activated charcoal. It will delay the absorption from the stomach. Then we can start gastric lavage, or we can remove the poison. Otherwise, till the gastric lavage time, the poison will absorb into blood. Then it will cause damage to the our body. Then 20th question, carotid endarterectomy is done to. Usually it is done to remove the plaque that is obstructing the carotid artery. So our option is option C, that is prevent a stroke by removing atherosclerotic plaques blocking cerebral vascular blood flow. So angioplasty, cerebral angioplasty also we can do if it is fails. So first measure carotid endarterectomy, that will remove the plaque that is obstructing or making a narrow on the cerebral blood flow. Then 21st question, normal PR interval. Normal PR interval, that is option B, 0.012 to 0.20. Option B is the correct answer. Normal PR interval. Then question number 22, impetigo is an inflammatory skin disease caused by. Correct answer is Staphylococcus aureus. Then 23rd question, an AMPG value with decreased PCO2, increased pH with normal bicarbonate indicate. So first ABG we need to see pH. In this question, pH is increased. So pH is increased means that is related to alkalosis. So next thing is we need to confirm whether it is respiratory alkalosis or metabolic alkalosis. So in first itself they have told that PCO2 is decreased and bicarbonate is normal. PCO2 decreased itself means it is related to respiratory reasons. So alkalosis is caused by respiratory reason, that is respiratory alkalosis. If changes in bicarbonate means it will be a metabolic, but in this question it is stated that PaCO2 is decreased. So respiratory alkalosis is the correct answer. 24th question, inability to recognize an object by feeling its size and shape is called. So correct answer is astereognosis. Astereognosis is the correct answer. Inability to recognize an object by feeling its size and shape. Then 5th question, Cushing's triad is observed in. So most of the people sometimes confused with the Cushing syndrome, but Cushing's triad, it is a manifestations of increased ICP. So that is usually seen in head injury. Then 26th question, the technique that uses ultrasound vibrations to break up the opacified lens material is called. Correct answer is phacoemulsification. For cataract surgery, the newer method, that is phacoemulsification, that will use ultrasound vibration to break up the opacified lens, and will put a newer lens to they will implant a newer lens. So that is what phacoemulsification surgery for cataract. Then the 27th question, the ideal cuff pressure of a tracheostomy tube, that is 20 to 30 centimeter of water. Option C. Then 28th question, the most common pathologic findings in individual with sudden cardiac death is, so usually due to CAD, that is atherosclerotic disease. So next option, next question 29, the oxygen delivery system chosen for the patient in acute respiratory failure should. So in ARDS or acute respiratory failure, we can give maintain the PA to 60 millimeter of mercury or greater at the lowest oxygen concentration possible. So that will helps to prevent the carbon dioxide buildup. So that is why low oxygen PaO2 is keeping. Then 30th question, the normal CSF protein is that is around 15 to 45 milligram of deciliter. Then 31st question, transverse cervical ligament is also known as, that is McEnroe's ligament. Transverse cervical ligament is also known as McEnroe's ligament. Then the placenta is derived from trophoblast. 33rd question, these are easier question. Antidote for magnesium sulfate, correct answer is calcium gluconate. Antidote for magnesium sulfate, that is calcium gluconate. Then deep transverse arrest can occur in this position. Usually occipital-posterior position, there will be chance for a deep transverse arrest. So correct option is option B, right occipital. Left occipital posterior also will cause, right occipital posterior also will cause. So in this option, right occipital posterior only there. So correct answer is option B. Then 35th question, superficial edema and bruising in the subcutaneous fatty tissue and around umbilicus. It is Cullen sign, usually seen in pancreatitis. Then 36th question, B-Lynch suture is applied in. Correct answer is postpartum hemorrhage. To reduce the postpartum hemorrhage, B-Lynch suture will apply, that will compress the bleeding artery and reduce the bleeding. 37th question, following drugs are used for ovulation induction except. So correct answer is danazole, that is used for endometriosis. All other medicines are used for inducting ovulations. Danazole, that is used in the case of endometriosis. Then 38th question, what is the ratio of chest compression to ventilation while resuscitating a newborn? Important point is newborn. So correct answer is 3:1. The resuscitation ratio for newborn is 3:1. Then transformation zone is closely associated with. Correct answer is cervical cancer. So while doing the cervical cancer test, pap smear test, so we need to take the sample from usually in the transformation phase, that is epithelial tissue transformation area is there. So exactly from there, if you are taking samples, means there will be more chance to get a true result, because that transformation zone cells are more vulnerable or will start more first for these cancerous multiplication. So that is why the transformation zone is important for cervical cancer assessment. Then for 40th question, the following are components of Bishop score except. In that, correct answer is fetal heart rate. Apart from that, all other are components of Bishop score. Fetal heart rate is not used. That is mainly used in Apgar while scoring Apgar score. Then 41st question, the recommended caloric requirement for 1-year-old child, that is around 1000 kilocalorie per day. Then 42nd question, an underdeveloped small mandible is a characteristic feature of. So correct answer is Pierre-Robin syndrome. An underdeveloped small mandible. Then 43rd question, which among the following statement is not true regarding the care of normal newborn? Correct answer, mother shouldn't be informed about the danger signals. Actually, mother should be explained about the danger signals, then only the parents can take early precautions or early intervention to solve the issues. So in this question, it is mentioned mother should not be informed. So that is incorrect. 44th question. The cranial suture found between two parietal bones. That is also easy question. That is sagittal suture. Then pasteurized culture negative human milk can be preserved in human milk bank for a period of. Correct answer is 4 to 6 months. So correct answer is 4 to 6 months. Pasteurized human milk. So in some countries there will be a human milk bank. So there will be compulsory human milk they have to give to this bank. So to store this human milk bank, so they can give the needed child. So it can be stored till 6 months. So in India, it is not widely used, but in foreign countries and all, usually for an example, Canada is one of the examples. There, the mother should compulsory. She has to give some 150 ml of breast milk to the human milk bank, so they can preserve it for 6 months. And any child is required this breast milk means they can give it from the bank. Then 46th question. A child can draw a complete triangle at. Correct answer is option D. Usually, after 4 years, the child is able to draw, but in answer key it is given, it is 5 years. So, child is able to draw a rectangle or triangle, etc. After 4 years. Then 47th question. Which among the following is seen in marasmus but not in kwashiorkor? Correct answer is good appetite. Which in good appetite will be there in marasmus, but it will not be there in kwashiorkor. Marasmus means that is protein and energy deficient. Kwashiorkor means only the protein deficiency. So in kwashiorkor there will be generalized edema due to the protein deficiency. Marasmus, the child will be very thin due to the deficiency of all the nutrients, most of all the nutrients, and mainly protein, and there will be energy deficiency also. Then 48th question. Colic, pain, vomiting, red currant jelly. So from here itself you can answer the question. Red currant jelly stools and palpable lump per abdomen are diagnostic features of. So here the feature is leads to intussusception. So red currant jelly stools are the main feature of intussusception. 49th question. Pancreatic insufficiency, neutropenia, metaphyseal dyschondroplasia and growth retardation are the characteristic feature of. Correct answer, Schwann syndrome. Pancreatic insufficiency, neutropenia, metaphyseal dyschondroplasia and growth retardation are the characteristic feature of Schwann syndrome. Then 50th question. Which among the following is a freeze sensitive vaccine? So correct answer is DPT. DPT is the freeze sensitive vaccine, or if it is kept in 0 degree or below 0 degree, it will lose its capacity or it will get destroyed. Then 51st question, that is, a client with the borderline personality disorder tend to idealize a friend as a perfect at the start of the relationship, but at the first disappointment, the client suddenly considers the friend as a cheater. The defense mechanism used is. Correct answer is option A, that is dissociation. Then 53rd question. An excitatory neurotransmitter in high level can excite a neuron to such an extent that the cells die. This property often referred to as excitotoxicity is associated with? Correct answer, that is glutamate. It is associated with glutamate, that neurotransmitter, excited neurotransmitter. Then 54th question. A forensic mental health nurse assists the law enforcement officers on the scene, assess the mental status of the perpetrator, participate in critique of the incident, and provide a link to mental health agency. This role is referred to as? Correct answer is hostage negotiator. Then 55th question. A nurse must possess certain quality to initiate and maintain therapeutic relationship. The following are the action orientation condition for facilitative nurse-patient relationship except. Correct answer is option C, empathy. Then 56th question. When administering medication, the nurse needs to assess the patient's response to medication. The nurse uses the following rating scale for assessment of neuroleptic induced Parkinsonism for patient receiving antipsychotic. So correct answer is Simpson-Angus rating scale. So nurse can use the Simpson-Angus rating scale here. 57th question. A mental health nurse works in a community or home along with other team members to provide unlimited medical, psychological and rehabilitative service to adults with severe mental illness. This type of community intervention is referred as? Correct answer is assertive community therapy. Then 58th question. 58th question, that is, a client who was recently diagnosed to have cancer says that the investigations are wrong and it can be happen to him. The nurse provides care to this client. Recognize this as an? Correct answer is emotion focused coping. 58th answer, emotion focused coping. In this answer I have a doubt. Actually I found appraisal focused coping, so please verify it. 58 question, answer is you should verify. In this answer key it is given emotion focused coping, so I have a doubt with appraisal focused coping, so please confirm this answer. Then 59th question. A client with mania makes a comment. The nurse during day shift did not allow me to go out of the ward. You are such a nice person who is very loving and caring. I know you will definitely allow me. The new assigned nurse also did not allow him to go out. Here the behavior of the nurse is based on the principle that. So correct answer is consistency is to be maintained. So if one nurse is not allowed means that should be followed by each and everyone in that ward. 60th question. A client presented with a condition in which a thought never entertained before is incorrectly regarded as a repetition of a previous thought. The nurse recognizes that it is. Correct answer is Dija Pense. So these are the terms are newer for you. So please study these terms and all. So that is why I am giving this answer key as much as possible, as much as earlier for you, because these terms are some questions are very new to me also. So it will be helpful to prepare any upcoming exams. So these questions will come repeatedly in next upcoming exams. So you need to understand. Dija Pense, a client presented with a condition in which a thought never entertained before is incorrectly regarded as a repetition of a previous thought. The nurse recognizes that it is. So in previously we have learned about Jamaisu and Deja vu. The Dija Pense is a new term. Then 61st question. Specificity is a test refers to its ability to detect. Specificity of a test refers to its ability to detect. Correct answer is true negative. 62nd question. Casual association of factors can be revealed by? Correct answer is case control study. Causal association of factors can be revealed by case control study. Then 63rd question. Ratio of the incidence of the disease among exposed and incidence of the disease among non-exposed is called. Correct answer is relative risk. Then 64th question. Corpulence index means. That is measurement of obesity. Corpulence index means that is a measurement of obesity. 65th question. That is the term tracking of blood pressure refers to. Correct answer. Follow-up of BP over a period of years from early childhood into adult life. The tracking of blood pressure refers to follow-up of BP over a period of years from early childhood into adult life. 66th question. In cold chain process, the walk-in cooler stores vaccines up to. In cold chain process, the walk-in cooler stores vaccines up to 3 months. Then 67th question. The number of live births per 1000 women in the reproductive age group in a given year is called. Correct answer is general fertility rate. The number of live births per 1000 women in the reproductive age group in a given year is called general fertility rate. 68th question. The purpose of sentinel surveillance is to. The purpose of sentinel surveillance is to. Correct answer option C, that is identifying the missing cases in a community. So if any disease is or any communicable disease is missing, or in that case, that is the main role of sentinel surveillance. Then 69th question. The simplest test widely used in India for the diagnosis of Kala Azar is. 69th question, option D, that is aldehyde test or Napier test. Aldehyde test of Napier. For diagnosing Kala Azar in India, widely used aldehyde test of Napier. Then 70th question, management technique which makes more detailed planning and more comprehensive supervision is called. That is program evaluation and review technique. Management technique which makes more detailed planning and more comprehensive supervision is called program evaluation and review technique. 71st question. To which of the 4 levels of Miller's pyramid does Oski conform to? To which of the 4 levels of Miller's pyramid does Oski conform to? Correct answer, that is shows how. So this is also a newer question for you. I think you need to study this in detail. So we will give questions related to this topic in next videos. So you can study this well. Next 72nd question. To which of the following domain does non-discursive communication belongs to? To which of the following domains does non-discursive communication belongs to? Correct answer is option B, psychomotor domain. Non-discursive communication belongs to psychomotor domain. 73rd question. Chief exponents of programmatism. Herbert Spencer, Arnold Berkeley, John Dewey, William James. Correct answer option C, that is John Dewey and William James. 74th question. Programmed learning is based on. Programmed learning is based on behavioral learning theory. Programmed learning is based on behavioral learning theory. 75th question. Which does Lewin's field theory purpose? Which does Lewin's theory purpose? Correct answer. Behavior is the result of the individual and environment. Lewin's field theory purpose. Behavior is the result of individual and environment. 76th question. Which among the following is the most appropriate instructional strategy that helps a learner to link something new and seemingly unfamiliar to something already understood? So, correct answer is Socratic questioning. Which among the following is the most appropriate instructional strategy that helps a learner to link something new and seemingly unfamiliar to something already understood? That is Socratic questioning. Then 77 in the question, ipsative assessment refers to. Ipsative assessment refers to, that is self-assessment. Ipsative assessment refers to self-assessment. Then 78th question, cathartic theory of education deals with. Cathartic theory of education is deals with. Correct answer is release of negative emotions. Cathartic theory of education deals with release of negative emotions. Then 79th, the Spearman-Brown prophecy formula relates to. The Spearman-Brown prophecy formula relates to. Correct answer option D, that is reliability of test. These questions are from nursing research. Then 80th question, which of the following statement is false about counseling? Which of the following statement is false about counseling? Correct answer, it is preventive. So that statement is false about counseling. 81 question number, role of devil's advocate in a team is to. Role of devil's advocate in a team is to. So correct answer is option B, that is reduce group think. Role of devil's advocate in a team is to reduce group think. Then 82nd question, which among the following statements are false about Japanese management style? So correct answer, hierarchical in nature. So hierarchical in nature statement, that is false about Japanese management style. And other statement, staff employment, implicit control measures are employed, collective decision making are true, and except hierarchical in nature, that statement is wrong about Japanese management style. 83rd question, according to McGregor, which among the following statements are true? So here four statements are given. So in that option A is correct. That is theory X leader believes that subordinates are extrinsically motivated. Then theory Y leader believes that subordinates are intrinsically motivated. So according to McGregor's, these two statements are true. Other two statements are wrong. Fourth question, in Six Sigma model, number of acceptable errors is. So correct answer is 3.4 per 1 million occurrence. In Six Sigma model, number of acceptable errors is 3.4 per 1 million occurrences. Then 85th question, the specification of contents, methods and relationships of a job in order to satisfy technological and organizational requirement as well as the following and personal requirement of the job holder is. Correct answer, job design. The specification of contents, methods, relationship of a job in order to satisfy technological and organizational requirement as well as the social and personal requirement of the job holder is job design. Then 86th question, 4/5 rule is connected with. 4/5 rule is connected with. Correct answer option D, that is adverse impact in selection process. So these questions are from nursing management. Then 87th question, job shadowing is connected with. Job shadowing is connected with apprenticeship. Job shadowing is connected with apprenticeship. Then 88th question, that is which among the following increase as group size increases? Which among the following increases as group size increases. Correct answer option C, that is social loafing. Then statistics. Formula for calculating a realistic time frame for project completion using PERT. That is for option 1. In that, correct option is option A. Option A is correct here. O plus 4m plus P divided by 4. That is correct here. 9th question. Inventory shrinkage cost refers to. Inventory shrinkage cost refers to. Correct answer option D. That is cost pilferage. Inventory shrinkage cost refers to cost of pilferage. 91 question number. Best strategy for worker. Best strategy for improving non-performing work. Mentoring means one leader has to supervise that particular worker. Like that they can improve. So 1:1 supervision. That will be helpful for a non-performing worker. Dash is the appropriate for the development of an employee who wants to take an additional responsibility. Dash is appropriate for the development of an employee who wants to take an additional responsibility. Correct answer is option C, that is giving such assignments. Then 93 question number. Gaussian distribution refers to. 93. Gaussian distribution refers to. Correct answer is option A, normal distribution. The 94th, these are questions from statistics. Formula of standard error of mean, that is SEM. So 94th correct answer is option D. Then delta divided by root of n, that is a correct answer here. Formula for standard error of mean. Then idea or image specifically invented for a new research, usually abstract in nature. The 95th correct answer is option C. An idea or image specifically invented for a new research, usually abstract in nature. That is construct. 96th question. Process by which dominant social groups impose their values and beliefs on others. Process by which dominant social groups impose their values and beliefs on others. Correct answer is cultural hegemony. Cultural hegemony is known as process by which dominant social groups impose their values and beliefs on others. Then 97th question. A cultural theory that challenges binary notions of sexuality and instead suggests that sexualities are cultural constructs. 97th question, correct answer is option A, that is queer theory. Queer theory. A cultural theory that challenges binary notions of sexuality and instead suggests that sexualities are cultural constructs. That is known as queer theory. Then 98th question. The event or perceived event that triggers a reaction in which people become excited to the point of losing their critical thinking abilities and acting irrationally. The event or perceived event that triggers a reaction in which people become excited to the point of losing their critical thinking abilities and acting irrationally. Correct answer is mass hysteria. Then then 99th question. A faculty heuristic in which you fixate on a single aspect of a problem to find a solution. A faculty heuristic in which you fixate on a single aspect of a problem to find a solution. 99th question, correct answer is anchoring bias. Then final question, social readjustment rating scale is designed to. Social readjustment rating scale is designed to measure stress. So these are the 100 questions they have asked in today's nursing tutor exams. Kerala PSC conducted nursing tutor exams questions. We have discussed 100 questions. So in that any questions you have any answer key you have doubt means you can report to Kerala PSC through the mail. So if you have any clarification or anything needed means you can comment in our below the video. So I will try to clarify. And these questions are very nice questions because most of the questions are newer to me also. So those who are planning to attend upcoming exams means you can try these questions and you can deeply go into each and every questions and study the theory. So like that you need to study. So upcoming exams like the nursing tutor exam, central aims nursing tutor exams are coming. So BARC, Baba Atomic Research Center exam is coming. Then ESIC I am expecting this year only. Within 2 months I am expecting ESIC recruitment notification also. So these are the major exams are in coming days. So please prepare. These questions you can try because new questions are there from statistics, nursing management, nursing education, sociology. These topics are rarely asked during the exams. So you need to so upcoming exams the management they will take questions from this topic also. So be prepared. So thank you for watching this video. Bye bye. If you like this video means please click the like button and share with your friends.